our entire society will get better when we have healthier men. And when we value men's health as much as we value women's health, which is really, if I had to sum it up in a sentence, that's where I'd like to be in 5 years would be wonderful, but it probably will take longer than that. When we can say that fatherhood is just as important as motherhood, and being a male, being a healthy male, is just as important as being a healthy female.
Armin Brott is one of the creators of the Certified Men's Health Educator Training Course, an online course that launched in 2022. It has 8 modules and can be completed in around 6 hours, working at your own pace. We want to help spread the word about this course and encourage people in Washington to get certified. Watch this interview with Armin to learn more. Is the course the kind of thing that someone can work through on their own schedule whenever they want?
Yeah. Oh, absolutely. It's online, 100% online. And there are people who have sat down and done it in a day. It probably takes about 6 hours or so to go through. So that it can be done in one stretch, or you can log on and do 15 minutes a night if you want, whatever works for you.
Is the content a mix of reading, videos, and like quizzes to check your understanding along the way?
There are 8 modules, and each module has learning objectives that we talk about in the very beginning, and then there's a 5 point or 5 question quiz at the end of each module, and then there's a final exam, which is something like 25 questions, I think, at the end of the whole course. You could do without a lot of the readings. There are additional readings. There's some publications that we've done that we encourage people to download and look through. Most of the content is delivered on the narrator, and so it's just like slides, like a nicer PowerPoint. I mean, there's slides, there's graphics, there's images, there's some video, but it's my voice narrating the content of the course.
Does it include physical health and mental health and even other areas of boys and men's health?
Yeah, we talk about physical health, mental health are certainly covered. It's not it's not for providers, so we're not giving examples on how to do a rectal exam or how to do testicular self exams or things like that. It's mostly to be aware of the fact that men die at younger ages and in greater numbers and greater rates of 9 out of the top 10 diseases, the things that you know, and that men have a shorter life expectancy now by about 6 years. And what accounts for that? What's going on there? Why is it that men and boys don't go to the doctor as often as women do? They're about half as likely to have seen a doctor in the previous year. What accounts for that? And then we're also, because we're looking not only at educating people about men's health, we're looking at what we can do to what we call reimagine the healthcare system so that it becomes welcoming to men. Because a lot of guys, boys and men, don't go get the healthcare they need because they feel unwelcome or unwanted or unseen in a traditional medical environment. And so we need to train the educators and the practitioners on how do you get guys to come in? Why should you get guys to come in? Well, because you get them to come in, then you get a baseline, so that the next time you see them, you can see, well, your numbers went up or your numbers went down or they stayed the same or whatever. I mean, the kinds of things that are so basically simple that you shouldn't have to talk about them. But so and then there's the big question. We have a whole unit on this: is how do you get them to come in? What sorts of things would you have to do to create an attractive men's health event that's going to get guys to come in? Because you can't just take a women's health fair and just say, okay, we're going to call it a men's health fair and we're going to do the same things. It's not going to work. You can't just paint it blue and have it be successful. You need to be able to think about what is it that brings men in? What is it that keeps them away? How do we do that? Well, do we need to have different hours, maybe open later in the evenings, open on the weekends? Do we need to have special events? Do we need to have men making the follow-up calls to guys, particularly about sensitive issues? That's all those kinds of things are going to help. Do we need to take a look at our waiting room and see what magazines are out there and what color the shelves and the walls are painted? Because as silly as it may sound, that makes a difference to some people, particularly younger guys. Some people, I don't know. I don't really think about it that much, but I have had moments where I've looked around and thought, God, there's nothing in here but women's magazines, and you pick up one of the parenting magazines and it's all of the nursing bras and everything. And all right, that's important, but it doesn't speak to me. So we're working as an organization on both sides, on the specific education part of it, but also the changing the system itself so that it becomes more welcoming and more guy friendly.
I know that the CDC played some role in making funding available to produce this course. What was that process like working with the CDC?
Well, we didn't work with CDCs directly. The way that it worked was that uh, the CDC gave funding, as far as I know, to the state of Tennessee, which funded the Rural Health Association of Tennessee, which then contracted with Men's Health Network, and then Men's Health Network contracted with us to create and provide the platform and collect the data for the actual course. We've had interactions with Men's Health Network just to, it's a pass through, but mostly we've been dealing with the Rural Health Association of Tennessee, which is where the program was piloted, and we're planning to launch it on a national level. If there's a soft launch, it's already out there, people can take it. But as far as folks in Tennessee who are educators or practitioners are eligible to take it for free for now. And it's been really remarkably successful. I think our initial goal was to have 25 people in the first year, and we've had 75 so far in less than, in significantly less than a year, just a little bit over 6 months. You don't know how things are going to be received or whether they'll have the impact that you want. And it's heartwarming, and also that's the one. Heartwarming is the one thing, but then it's also, we're seeing that this is a viable thing, and it's really producing good results, and that's the most important thing. Is if we can accomplish our goal, which is to reimagine the healthcare system, and that's what we're trying to do with this course, then we're going to be really thrilled that we've made some headroad into improving men's health, which has been languishing for many years, and really does need to have some specific focus on it. So far, we've had 75 people graduate from the course, and 48 of them have filled out a survey. So the very good survey response, talking about basically what they learned, whether it's applicable to their job, whether they think they're going to be able to apply it, whether they think it's improved their interactions or their interactions with boys and men, and whether they'd recommend the course to other people. So that the results are very good. The people who took it were mostly urban or suburban. It was about half rural and half urban or suburban, some in corporate. Most of them, interestingly, the majority, 75%, had more than 5 years of experience, and 45% had more than 10 years of experience. So these are people who are taking the course, who are finding it really valuable, who are experts in their field already, but they're not experts in the field of men's health. The first statistic that I was gathering, and I expanded it to get this larger, it's like a 20-question survey. But the first thing I was looking at, just the big data point, was what was their score on the pre-test that we gave them at the very beginning before the course even started, and then what was their score on the final exam. And so the answer to that one was also very heartwarming, and that we realized we're doing good work, is that the average score on the pre-test was about 42%, and the average score on the final exam is about 89%. So more than doubling their knowledge of men's health needs, men's health specific peculiarities and issues having to do with men and boys. This is not only people who are practitioners, who are medical practitioners. There's also mental health professionals, people who are educators already. They're just doing general health education, and now they're being certified and increasing their knowledge of boys and men's health specifics. So they're going to be able to not necessarily become all of a sudden men's health specialists, but they'll be able to better serve the men and the boys that they're serving right now who are not getting the best possible service, because until they started taking the course, most of the people who didn't really understand what was so special about or so unique about men's health to begin with. So now that they know, they'll be able to provide services better to the people they're already seeing. And we're also anticipating that a lot of these people will be starting to do specific outreach to men. 70% have not done any programs yet, but they plan to. But a third have already done at least one and as many as 4 programs. So nobody has said this was a waste of time or I'll never be able to use it. So it's either I think I'll be able to use it, I already have, or I already do a lot, which is I mean, from the perspective of somebody, my partners and myself putting together a program, that's really what we want to know is, are people learning something? Yes. And also, are they implementing it? And is this going to help translate into better health outcomes for men and boys? And the answer seems to be yes.
What are you seeing as far as the gender breakdown among participants in getting this training? And did you have some goal for wanting to see especially a lot of men or especially a lot of women take the course?
I really, really wish that I would have thought of that, because it didn't even, for some reason, didn't even occur to me to look at the gender breakdown. I'm going to do that as soon as we get off this call. I'm going to look it up and see. My sense is it's probably 60-40 women. And I've joked over the years that men's health is a women's issue, and it really is. But we're also dealing with public health. And the reality of it is that most of the people in public health are women, and public health nurses and public health educators are going to be women. There are more of them. There's a shortage of male providers, particularly male providers of color. One of the things I'd like to do, it's on our list of things to work on in this year, is to try to get the course certified by like the Nurse Practitioners Association or the American Public Health Nurses Association, that kind of thing, so that they can have it as a continuing education course, which would enable their practitioners to get better up to speed and could help bring more folks in, again, more males in as providers. It's certified by Healthy Men. So you've got me. I've been working in the men's health field for more than 20 years. Sal Giorgiani is a PhD as a pharmacist and worked for Pfizer for 28 years. Also very, very involved in men's health issues for over 30 years. And Jean Bonhomme is a practicing faculty member. He sees people in clinic, but he's also on the faculty of Emory University and has been working in men's health. And he's one of the founders of the Black Men's Health Network. And so he brings that particular expertise. So between the 3 of us, we have enough knowledge, enough standing in the field to feel that we can certify that these people know what they're talking about.
Is the $249 price tag something you're experimenting with? Something that's pretty locked in? How does that work?
Well, because it was being piloted in Tennessee, what happens was that you mentioned the CDC grant. So the grant money that came from CDC through the Rural Health Association to us enabled people in Tennessee to take the course for free. But we needed to creating the website, thinking a little bit further ahead that we're going to want to launch this on a national level. So we had to come up with a price. And so we thought $249 seems reasonable. And we've actually had a bunch of people who have found us on Google searches or otherwise who have taken the course directly, not going through the Tennessee free thing. But what we've done for a lot of folks is to say, look, it's not everybody can afford $249, so we'd be happy to give you a discount on it. Or if you're able to bring in, say, 5 or 6 of your colleagues, we'll give it to you for free and give them a discount. So it's definitely flexible. We are, if we're going to be talking to somebody like Blue Cross Blue Shield or the the state health department of New York, it's not going to be as cheap as it might be for a small practice in Mississippi. It's academy.healthymen.org. The Healthy Men Academy has the certified men's health educator as one pillar. And then we've also got other programs that we're developing that will be part of the academy. So we're going to be rearranging the URL. But right now, the academy.healthymen.org takes you right to that page, to the certified men's health educator page. And then you can learn all about the learning objectives and what's in the course, what's not in the course, and how to proceed. And if somebody's listening to this or seeing this and they want to get a discount on the code, or they have a group of people they want to bring in, my email is very simple: Armin Brott, ab@healthymen.org.
You talked a little bit earlier about ways in which the healthcare system has some improvements before you consider it fully guy-friendly. I think that's language that's used on the website,
Yeah.
guy-friendly. And I appreciate that. Can you say a bit more about what ways in which there's improvements to be made to make things more guy-friendly?
Well, I think that a lot of providers do not understand what's going on with men's health. They don't understand that they can't treat men and women the same in practices, and they aren't educated. There was a study that was done a couple of years ago by the Commonwealth Foundation, and they were finding that a majority of doctors did not offer men the same appropriate screenings for their age. So at 45, for example, people should be screened for conditions A, B, C, D. And if you're at a higher risk of prostate cancer, for example, most people are getting screened starting in about their 40s. But if you're a Black man, you ought to be getting screened for prostate cancer sooner than that. They're not teaching guys how to do testicular self-exams. Testicular cancer is relatively rare. However, it's one of the biggest cancers for young men, 16 to 35. So there's just this lack of awareness. And there's also, with providers, that sometimes they're limited to 6 or 10 minutes per visit, and they just don't have the opportunity. Plus, you've got guys that are not coming in, and there is not the kind of outreach that needs to be done to get guys to come in and have a physical, so we can establish some baselines for their health. So that's it. And I mentioned just real briefly, I mean, things like office hours makes a difference. That if guys, that's part of being a man these days. It's just so many survey after survey that being the provider protector is way up on people's list of what it means to be a father or be a man. And so that means you're not going to take off early in the middle of the day to go to a doctor. So if you can't get a doctor visit after hours, you may not go, and you may not go for 10 or 20 years. And so the lack of outreach, the lack of an education, the lack of understanding are big things. And then there's also there's not specifically the healthcare system, but it's our entire culture. Is you and I and almost every other guy out there grew up with big boys don't cry, and take one for the team, and man up, and those kinds of things, which are decidedly dangerous. They basically say, don't ask for help. And that translates directly to the fact that suicides are a predominantly male occurrence. 80% of suicides are male. That's 4 out of 5 are male, and 2/3 of opiate overdose deaths are males. And we're not recognizing these things as a society, as a culture, and these are not being recognized in public health situations. Actually, I had a conversation with a guy who runs the county health department here. We said, well, give me an example of a men's health concern. So you're a public health, you're running the health department. How about suicide and opiate overdoses? How about that, just to start with? And he said, you're right. If it were the other way around, and women were accounting for 2/3 of opiate deaths and 80% of suicides, there would be a nationwide women's health crisis, and we would know what to do. we would mobilize the providers, we'd mobilize the educators, and we'd get out there and we'd have public service announcements. And that doesn't exist. It doesn't exist. There are many, I think there are 7 within the federal government, offices of women's health, that not including the National Institutes of Health and what's in the HHS. There's a lot of budget that goes billions of dollars a year, budget that's focused specifically on women's health, the offices of women's health. There are exactly that many. I mean, the 0, not the fingers. 0 offices of men's health anywhere in the federal government that have a budget, and it's pretty surprising. So it's the healthcare system itself, the providers and the educators that we want to reach. But we also want to reach, as a bigger goal, we want to change the culture. The fact that we're talking about men's health does not in any way diminish the focus that should be on women's health. Women can be healthier too, but that gap, the gap between men's lifespan and women's lifespan, is significant. That's 6 or 7 years. We figured out, I did a paper, as the primary author on a paper a few years ago, that lifespan, just that difference of 7 years, not to get men as healthy as, that they could live to 120, but just that they should be able to live as long as women. It costs about $450 billion a year in this country. Just think of how much tax revenue is lost by guys who are dead and they're not paying taxes, and how much extra benefits have to be paid out to widows and survivors of those guys who are dead, or how much work productivity is lost by guys who are injured or diminished in some way, or they're not productive at work because they can't work, they're too sick to work full time.
Yeah, not to mention the lost time that children lose with their fathers who are dead.
Oh, well, that's a whole other thing that goes beyond the financial to the quality of life. And then, exactly, I mean, you know, the fallout from that, the kids who are growing up without an actively involved dad, or without a dad at all, are more likely to get involved in drugs and alcohol. They're more likely to become teen parents. They're more likely to end up in jail. So it's a whole cascade of negative effects that happens when you neglect men's health. And the reality of it is this famous expression, the rising tide lifts all boats. When we pay attention to men's health and we get men healthier, women and children and families in our society are going to be healthier as well.
Are you finding some challenges to get the word out about this? And what do you anticipate as far as if you can scale up this program and try to reach more people to be trained and get the certification? What do you have in mind to be able to market it so you get lots of participation?
Well, we're able to get the word out. I mean, we've been doing it kind of quietly. There was the full launch for the Tennessee program, and then a soft launch of the nationwide program, because we were really focusing on perfecting the Tennessee one and getting it up and running. We wanted to make sure that that was really going to be a quality product before we took it national. So it's not, getting it out there has not been a problem. We haven't spent a lot of time on the marketing side of it. And so talking to people like you who are generously offering to help us get the word out is really terrific, and I thank you. We're also, it's mentioned that I'm going to be speaking at this conference in June of public health educators and public health nurses, so that I think is going to help get the word out. We need to be doing more outreach on an individual level, and also we have begun to form some partnerships with companies. We did an educational program on vaccines earlier, a couple months ago, when the height of the flu vaccine, the height of the flu pandemic, well, not pandemic, the height of the flu season, what I'm looking for, I'm sorry. So we did that, really a campaign for these folks, targeting men, encouraging men to get flu vaccines, and encouraging men to encourage the people in their family to get flu vaccines. No, understanding that most people have got vaccine fatigue at this point, but there are a lot of people, for example, who just didn't know that if you get a flu vaccine, that doesn't protect you against COVID, and if you get a COVID vaccine, that doesn't protect you against the flu. You need them both, particularly if you are an older person or you have asthma or some sort of condition that you're immunocompromised or something like that. So it's a lot of education. So we are getting the word out there. It's slow. Men's health is not on everybody's front burner, and I think in fact it's on the back burner. A lot of people, and I just mentioned this a minute ago, but a lot of people actually push back and say, "You're trying to take something away from women," and I'm saying, absolutely not. Absolutely not. Not taking anything away from women at all. We are encouraging women. We support women's health, and we're in a way kind of envious of what women have accomplished to get women's health on the front burner and to make it such a national issue. We want to do the same thing, and there's no reason why we can't do both. We need to do both. So there is some pushback. There is some, oh, this isn't politically correct to do this, and oh, men have it all, and that sort of stuff, which is just nonsense. But we've also, again, we were approached by a company that wanted our help in getting the word out specifically to men. So there are some folks who are recognizing that as much as we'd like to have men and women be interchangeable these days, it's just not happening. And there are going to be, for a while, there are going to be differences between men and women that we have to recognize, and we have to deal with these things. And for whatever reason, well, we know the reasons, there's a lot of reasons, but men aren't going to the doctor as much as women are. Men are not taking as much care of themselves as women are, and we need to fix that.
I hope that in the future, we're going to see plenty of organizations, governments, news outlets, media, who don't specifically have a pro-male focus like I do, but who just want to cover important issues, will be eager to interview you and to get the word out about this program.
I would hope so. I mean, there's plenty of room, and I think that, again, the most important part of it I see is that we're all linked together here. That when you help guys get better, and help men to understand that asking for help, particularly for mental health issues, is not a sign of weakness; it's a sign of strength. That's going to help the entire family. You mentioned it. It's going to help their kids. It's going to help their partners, their mothers, their fathers, whatever it is. Our entire society will get better when we have healthier men, and when we value men's health as much as we value women's health, which is really, if I had to sum it up in a sentence, that's where I'd like to be. In 5 years would be wonderful, but it probably will take longer than that, when we can say that fatherhood is just as important as motherhood, and being a male, being a healthy male, is just as important as being a healthy female.
A society in which the well-being of everyone is equally sought, including boys and men.
Yeah, I think you're right. But it's a lofty goal, and it may be something you'll pass on to your kids to fulfill. But it's something that I'm happy to help you with, if I can in any way. I mean, there's plenty of room in this field for all of us, and we're not trying to say that we're the only ones in town who can provide any kind of insight or service. There's tons of ignorance out there, and so the more help people can get, the better off we'll all be.